Mr. Grant, my name's Connie. I'm going to be your nurse for the day.
Hi,
I'm
Judy.
Judy? Okay.
His wife. I'm so worried about him. He's
Okay,
never
Judy,
sounded so
well, I'm going to check him
horrible.
out this morning and see how he's doing, because I know he just came up from the ER.
Okay,
So I need to check his blood pressure. Okay, I'll get him
he's-
dressed up as soon as I get
I
him.
know,
Let me
but
just peek at his
he's
arm here, make sure his blood pressure cuff's on.
I've just never heard him
Okay.
sound like this
I want to
before.
get your vital signs here and see how you're doing, okay?
Are you okay, sweetie?
And I'll get
Do
your
you hear
temperature.
how bad he is?
Yeah, I
Does he
know. Let
sound
me
bad
just
to you?
assess
He
him
sounds
so I
really
know
bad
what's
to
going
me.
on. I've got to get a baseline, okay? Should get your temperature. That goes under your tongue. Okay, great.
Did he have a temperature?
Let's see. Yes, he does have a low-grade temperature, yes. Okay,
It
then I'm
just
going to
is
check
so
his O2
cold.
sats.
He's very cold.
Okay, I'll get him a blanket. Well, I really don't want to put a blanket on right now with his temperature like that. Let me get him assessed and listen to his lungs, okay?
Let's just keep him covered though, okay?
Okay, that's your O2 sat. Let's see what your O2 sat comes out to be, about 91, okay?
It's okay, sweetie.
All right, I'm going to check your heart rate, and I'm going to listen to his lungs, okay?
I've just never
All
heard
right,
him
let me just
sound
pull
so
it down here.
horrible.
Oh,
Let me just put this up just a little bit.
Okay, now I want you to take some deep breaths for me. In and out. Really
It's just
deep.
bad.
Okay, good. Okay, in and out. Okay, one more time. Okay,
How's
you got
it sound?
quite a bit of wheezing in there. Let me just count your respirations. Okay, just wanna.
Let me cover him.
Okay, and your respiratory rate, yeah, you're breathing at 30, so you're breathing quite fast. Okay, and you've got some wheezing. What do you usually do at home when you're like this and you're wheezing?
I use a little puffer
A
deal.
little puffer deal. Okay, do you know what it's called?
Albuminol or
Okay,
Yeah, something like that.
Okay, let me check your medication list here and see what I can give you.
Okay.
Yeah, it looks like you've got albuterol ordered. Okay, so I'm going to give you that.
Yeah.
Let me check your name band over here, okay? Match it up here. Okay, Carrie Grant. And Carrie, what's your birth date?
6/21/63.
Okay, and I notice you're also allergic to penicillin.
Oh, yeah.
Okay.
Yeah, in a
Oh.
big way.
Okay, all right. So let's try your inhaler here. Okay, I want you to take 2 puffs, okay?
Oh, he always does more than 2 puffs.
Okay, well, we're going to try for 2 right now because that's what the
I never
doctor's
see him
ordered.
do 2.
Okay, but let's see how it does,
Three or
okay? You
4.
take it. I'm going to push this and I want you to inhale. Ready? Go. Okay, take a deep breath. Quite a cough there. One more time. Inhale. Okay, great. All right, let's see how this works, okay?
Don't you think he sounds horrible? I'm so nervous
Yeah,
for
let me
him.
listen again and see if this helped any, okay?
Calm down,
We
sweetie.
might need to call the doctor.
Why don't you go ahead and do that now?
Yeah, you're still wheezing pretty bad.
Can you just call him now?
Yeah, I will. Okay. All right, Mr. Grant, I'm going to call your physician and see what she would like. Let me just write down your information here so I can give it to her on the phone.
I just don't think I've ever felt this bad before.
I know you sound horrible. I know you're going to be
Hi, Dr.
okay.
Clooney.
Dr.
This is
Clooney's
Connie from
coming.
3 West. I have a patient of yours, Carrie Grant. Came up from ER about 2 hours ago with asthma. He's really short of breath still. He had 2 puffs of albuterol and he's still wheezing.
You always
Is
do
there
3 or
anything
4,
else we can
right?
do? Let's see, his blood pressure is 152/91, heart rate is 104, respiratory rate is 30, and his O2
Are you
sats
okay,
are
Carrie?
92% on 2 liters of
Are you relaxing a little bit? Huh?
Yeah, but I'm feeling chilled, you know.
I
I'm
know.
kinda
I'm
sweaty.
feeling a little temperature.
IV push stat, and I am in-house, so I'll be down in about 10 minutes. You got it?
Okay, sure. Let me repeat these to you, okay? You want me to call RT Stat for a nebulizer treatment?
Right.
And Solumetrol 50 milligrams IV push
Right.
now, and you're going to be up in about 10 minutes.
You got it.
Okay.
Okay. Bye.
Going up a little.
Yeah.
It's from the
Relax,
medicine.
sweetie. Relax.
Might make you a little jittery, this medicine.
Okay, we can give you that
Really?
Yeah.
every 4 hours or so as needed.
I don't know
Right.
if he's ever
Take a
had
nice
this
deep
medicine
breath.
before.
Oh,
He
okay.
might if he's been
Take
in
a little
with
while
asthma
for it to
before.
work. I think you're going to be okay. Breathe in that oxygen nice and deep to your lungs, okay?
Okay, Mr. Grant, I have your Solumetrol here for you, okay? I just need to check your name band.
Again?
I do. Every time I give his medicine, I check his
Oh.
name down.
He hasn't
Dad,
gotten
your memory's as bad as mine is.
No, I do that for safety, okay? This is Solumedrol, and it's used to decrease inflammation in your lungs, and I'm going to give it through your IV, okay? And this is going to help with the
Giving us
inflammation.
Solumedrol now. I called like
I'm
10 minutes
Dr.
ago.
Goody,
Judy.
Yeah,
Good
let me
to
check your
see
name
you.
down.
Don't worry, everything's gonna be
Okay,
fine.
this is
How's
going
it
to
going,
help
Carrie?
with your breathing. I
Sounds
hope.
horrible.
Will you, nurse?
Okay,
It's been a really
got
bad
it going.
day for
Is it?
him. Oh my
Okay. Well, we're
gosh.
gonna fix him up here.
He's really wiped
that
out from
in.
all this too.
Hey, Carrie.
Hey, Doc.
Connie's been very nice though. She's
Yeah.
been really nice.
All right, Connie. You know what? Let's
you.
give him. We're gonna give you some antibiotics. I'd like him to have
to see
Judy, excuse me, 2 grams of Ansef IV piggyback stat. And we'll get those antibiotics in, and then I'll be back to
But
see.
You
what
know,
about
wait,
his
Dr.
allergy?
Clooney, he has an allergy to penicillin.
I know that he's my patient,
I
but
know.
the chances of there being any sort of interaction whatsoever are very minimal. So
No,
I'd like
you know,
to
I'm
hang.
not really comfortable with that. Maybe we could discuss it with the charge nurse or pharmacy.
I'm the physician.
Well, what kind of reaction did you have, Mr. Grant, when you did get the?
Oh my God, it was the most frightening day of my
I
life.
had a doozy and they gave it
Much
to me.
worse than you
and
see
I
him
started
today.
having
It was just frightening.
trouble breathing and I passed out
Yeah.
and then I woke up 3 days later.
never want that to happen.
You know, that kind of
Yeah.
sounds like
Gotta get moving
anaphylaxis,
here.
fulminant anaphylaxis. I'm not comfortable giving it.
You're not comfortable giving
No.
it, and you want to give your charge nurse. You know what?
Yes.
I don't have time for this. Let's just give
Okay.
him Cipro, okay? Do
How
you have
much
Cipro
Cipro?
over there? Give him 1 gram stat, IV piggyback,
wanna be
and Q12 hours. Okay, we'll fix him up. We'll give him some Cipro.
Cipro 1 gram
Okay.
IV stat.
Yes,
I'll get
and
it ordered from the
Q12.
pharmacy.
Thanks
And
for
then every
getting right
12
down
hours.
here,
Okay,
Dr.
thank you.
All
I feel
right.
much better with that.
All right, good
Thank
call.
Okay, Carrie. The nurse will be here. Settle
Good
down.
morning, Mr. Grant.
Oh,
Hi, I'm
hi.
Connie.
Hi,
I'm the
Connie. I'm
nurse for
Judy. I'm
today.
Carrie's wife, and he's just horrible
Having a hard
today.
time breathing.
Horrible.
Okay.
I've just never seen him like this.
Okay, well, let me
It's
check
really
you out. I
bad.
want to get your blood pressure and your vital signs,
But he's-
okay?
she's going to take your temperature.
Okay.
Isn't it really bad?
Well, he's, let me check him out and then I'll let you know. Okay, I got the temperature. Let me get a pulse ox and see what he's doing there.
It's okay, sweetie. Let's try to
Alright,
keep
just
him
put this on
covered
your
because I know
finger.
that he's really cold.
Okay, all right. Is your
I think he has a
saturation's
temperature too.
91. Okay, I'm going to listen to your lungs, okay?
Yeah, sure. Whatever you think.
I'll try to keep him as covered as much as I can, okay? Take some deep breaths for me.
It's hard for
In and
him.
out. Okay, good. Another one? Okay, one more. Okay. And let me just listen to your heart here for a minute. Okay, all right. Well, it sounds
How's
like
it
you're
sound?
wheezing pretty good in there. Okay. What do you do when you're wheezing like this at home?
I use my little puffer.
Your little puffer, what is that, an inhaler?
Yeah, my inhaler.
Okay, and what's the medicine?
Albuterol or
Okay, I think
Something
that's
like
albuterol.
that,
Okay,
yeah.
let me check your medication list here and see what you've got. Yeah, 'cause you've got albuterol.
Right,
Ordered 2
Albuterol.
puffs. Okay, with a spacer. Okay, I've got that here.
And he takes about, oh my gosh, 3 or 4 or 5 puffs when he does it.
Okay, well right now we're only gonna let you take 2 puffs because that's what your doctor's
But he
ordered.
never
Okay,
just
let me
takes-
just take
he
you to
never just
man
takes
over
2.
here to see if I got the right patient.
never takes 2.
Okay, Carrie Grant. And what's your
doesn't-
date of birth, Mr.
She
Grant?
doesn't help for him.
June 21st, 1963.
Oh, okay, great, great. And it looks like you're allergic to penicillin,
Yeah.
is that correct?
Oh yeah, in a big way.
Okay. Well, this is your albuterol inhaler, and I'm going to want you to take 2 puffs, okay? So I'm going to hold this
But
up
2
to your
doesn't
mouth,
work for him.
and I want you to inhale. Ready? Go. Okay, we're going to do 1 more puff. Okay, wait till you stop coughing. All right,
Can you
ready?
go ahead and give him
Go.
3? Because, I mean, I've never seen him just
You know, I
take 2.
can't. 2 is what the physician ordered, and that's what I've got to stick by.
I don't feel any better.
You don't feel any better. Okay, let me just check for sure. Yeah, still quite a bit of wheezing in there. Okay, that didn't help too much. Okay, I'm gonna go give Dr. Clooney a call, and I'll come back and let you know what she says,
Yeah, yeah,
okay?
definitely
Let me just write down
temperature.
your vital signs here so I can
Are you
let her
okay,
know.
sweetie?
You got a little bit of a fever too,
Yeah.
okay? Let's see, his blood pressure is 152/91, heart rate is 104, Respiratory rate is 30, and his O2
Are you
sats
okay,
are
Carrie?
92% on 2 liters of
Are you relaxing a little bit?
Yeah, but I'm feeling chilled, you know.
I
it's
know,
kinda
I know. I'm
sweaty.
feeling a little temperature.
IV push, stat, and I am in-house, so I'll be down in about 10 minutes. You got it?
Okay, sure. Let me repeat these to you, okay? You want me to call RT Stat for a nebulizer treatment?
Right.
And Solumetrol 50 milligrams IV push
Right.
now, and you're going to be up in about 10 minutes.
You got it.
Okay.
Okay. Bye.
This is Connie up on 4th floor, and I need a treatment for Mr. Cary Grant in room 408. Yes, that's Stat.
Carrie, but
Hi,
he's
Colin.
very cold,
Yeah,
so
this is
try to
Mr.
keep him
Grant,
covered,
and he is a
please.
46-year-old male. Came up from ER with asthma
meet you.
about 3 hours ago. Heavy
He's
smoker at
really in
home.
bad condition right now.
Wheezing a lot, short of breath.
I'm
He
really
had
concerned about
2
him.
puffs of albuterol, and it didn't really
He
help.
should have had more than 2. He never does 2.
Handheld neb?
Yeah, Dr. Clutie ordered a handheld neb, and she's going to come up and see him also.
Okay, we'll get that right away for you, Mr. Grant.
What's a handheld neb?
It's the same medication, but it's in a real fine mist, real fine aerosol. It'll get into his lungs better, and it'll help you breathe a lot better,
I
Mr.
had
Grant.
this down in the emergency room.
Can we keep him covered? I'm so worried about how
certainly.
cold he is.
Absolutely. Let me just,
I think he has a little fever.
let's see, he's 91, 93?
Yeah, he is.
He's on 2 liters.
Right.
Is it okay with you if I bump him up a little bit?
Sure, that would be fine.
I'll
Does he
put him
need
to
to take
4.
like deep breaths when
Yeah,
he's
4 is
doing
good.
this?
I'm just getting his medication
Yeah.
ready here. Let me bump him up to 4.
Mr. Grant, nice deep breaths.
Okay, he's up to 4 liters.
Alrighty. We'll be back to give you that every 4 hours or so as needed, okay?
I'll let you know if I need you again. I got your phone number. Okay.
Thank you.
All right.
Bye, Mr. Grant.
Okay, Mr. Grant, now I have
Thank
your
you for coming.
Solumetrol to give you. Okay, this is to decrease the inflammation in your lungs.
But you know he's got an
Alright.
allergy to penicillin.
Yeah, but this isn't related to penicillin, so
Are you
I just
sure?
need to check your name band again. It's Mr.
Oh my God,
Cary
you have to check it
Grant.
again?
Yeah,
He
I got
hasn't
the
moved.
medical record number this time.
You
Okay,
admit
6, 7, 8, 1, 2,
your
3. That's
memory's as
correct.
bad as mine is. huh?
Okay. All right. Oh, hi, Dr. Clooney.
Is that the Solumetrol I ordered
Yes.
10 minutes
So
ago?
quick. Yeah, it is. I'm getting it as fast as I
Hey,
can.
Carrie, what's up? What's happening with you?
Carrie's not having a good day.
Now, let's get that Solumetrol in.
Okay, I'm
Yeah.
gonna start pushing it
Got a
down.
little cough?
Oh, it's bad.
You still smoking?
Oh, no, I only smoke when I'm awake now.
Okay.
See, he
So,
still has
Dr.
a sense of
Clooney, he's up from ER with asthma. I think I told you that earlier on the
She
phone.
knows that
You can
she's-
see the current temperature is
she's a
kind of
doctor.
going up here. It's now 38.9.
Yeah.
He's been wheezing quite a bit. Gave him the Solumetrol, and he had a respiratory therapy treatment.
Are you feeling
You know, I
better
want to
from
get some
that treatment?
antibiotics on board, just in
Okay.
case there's
But let's
something
not
going
forget
on
about
there.
the penicillin, please.
Well, give him Ansef, 2 grams, IV piggyback stat.
Okay, I'm a little leery about that with him being allergic to penicillin. Mr.
Alright.
Grant, what happens when you take the penicillin?
Oh,
that was the worst. That was the worst.
All I remember.
I never want to see him like that again. Scared me to death.
This is very, very different. This is different. It's the chances of there being any problem
we
whatsoever
wanna
are
take a
very
chance?
slim. So why don't you just go ahead and give it?
Sounds like anaphylaxis. Are you sure?
I'm the doctor. You're the
Okay.
nurse.
All right.
wanna
Okay.
take a
You're
minute?
right. You know better. I'll give it.
Do you not trust me? It's okay. Go ahead and give the
Okay.
Ansef. I
Okay.
mean, well, you
If Carrie
probably
feels
had
good
that
about it, then I'll feel
reaction
good
a
about
long,
it.
long time ago. Okay, so hang that Ansef, and I'll come and check on you later. We're still waiting for some labs, and I'm going to be making rounds later. Okay?
What time do you think
Okay.
that'll be?
Oh, I don't know, a couple hours.